now with blockchain technology, we have the ability to have self-sovereign identities, meaning the cryptography encodes for you to own your identity untethered from any centralized entity or source. And that's why it allows for censorship-free communication. Because if you own it and you control it, who can censor you?
Welcome to the Licensed to Live show, where professionals, doctors, champions, VIPs, attorneys, and those in public office discover strategies that help you restart and gain what is lost when you find yourself accused. If another has doubted your integrity, questioned your credentials, or caused your actions to come under scrutiny, you are in the right place. On the other hand, if you have never felt the knot in the pit of your stomach when legal papers are served, the heartbreak of disappointing your family when the lock clicks shut on handcuffs, or had to appear before a board of review, then be aware, the longer you serve, the more likely you are to find yourself under the microscope of those who judge. Prepare yourself for this uncomfortable possibility. Now, here's your host, Dr. Jarrett Patton.
Welcome to this episode of Licensed to Live. My name is Dr. Jarrett, and I'm your host for our journey together today and every day you choose to listen to this show. If you or anyone you know has been dissed by the healthcare system, please invite them to join us along this journey. Just go to Apple Podcasts, Google Play Podcasts, Stitcher, or anywhere you get your podcasts and subscribe to the Licensed to Live show. While you're there, please rate this episode and give me honest feedback so I make sure I provide you with the most up-to-date information about career and life changes. When I say dissed, I mean disengaged, like, this medicine thing is not what it's cracked up to be. Too much paperwork, too many administrators telling me what to do, or I don't have enough time with my patients. Dissatisfied, like, I just don't feel like I'm living up to my full potential. This career simply isn't fulfilling. Disgruntled, like, being a doctor has taken too much of my life away. I am in debt up to my eyeballs, and I'm upset because my work life is too full and my real life is left barren. Or disenfranchised, like I was when I had my medical license temporarily suspended. This show is not for those physicians who are happy and fulfilled in their clinical career or who have never had a setback in life. If you are in this category, tell a friend, but your time is coming. Today, we'll be talking with Dr. Leah Houston, an emergency physician who runs her own concierge practice, a blockchain expert, and the founding partner of HPEC. We will discuss blockchain technology and how it can improve your career. Before we get started, I would like to let you know about a special opportunity coming up. We have opened up a few additional spots in the Licensed to Live coaching program. This 3-month program is designed to help you refresh and restart your career so that you have a better life. This transformational plan will help you have the credibility, confidence, and courage to make that leap into the career you desire. There are only a few spots remaining for this New Year's special, so make an appointment with me for your free strategy session to see if you qualify at timewithdrjarrett.com. That's time with, spell out the word doctor, J-A, 2 R's, E, 1 T. Welcome to Licensed to Live, Dr. Houston. It's a pleasure to have you on the show to discuss something that few physicians truly understand. Blockchain. Welcome.
Thank you so much for having me.
Your credentials are pretty impressive. I mean, you've trained as an emergency room physician and now serve as a concierge doctor that incorporates personal care, holistic wellness, and precision medicine. Tell me a little bit more about your adventure into medicine, how you got there, and where did you get your entrepreneurial spirit?
Yeah, so I actually recently started transitioning my practice into a DPC practice after learning about it at the recent Nuts and Bolts conference. My entrepreneurial spirit started from a very, very young age. I was the kid selling gum during lunchtime, was always moving. I had several jobs in high school. I was building little inventions when I was a child and cooking concoctions for my family to try. And, I think that my venture into medicine was because I really loved science and I wanted to help people. I always had lots of things going on in the background. I had, been involved in health policy for many years and public policy. Like everybody else who's listening to this show, I was so excited to really make my contribution and make my mark in medicine and go out and help people and make a difference. But as I was practicing, I noticed there's just something wrong with what's going on and how it's happening. And I realized that something needed to be changed. And the thing that pushed me over the edge was when a hospital stole my identity.
Wow. They stole your identity?
Yeah. So, we all have NPI numbers. If we work in health systems, we have to have Medicare and Medicaid PTAN numbers. And those are the numbers that allow the hospital to bill under your professional identity. And, you fill out all these pieces of paper when you credential for a hospital, essentially telling, signing away your rights and allowing the health system to use those numbers as they see fit. And in this current centralized system, that's the only way to do it because, you need a middleman between you and CMS and you and the insurance company, or else you're going to be sitting there pushing paper in the wee hours of the night. So the thing that happened is when I left a hospital and left that state, the person who was responsible for removing my name from the list of physicians who were supervising mid-level providers in that emergency department did not remove my name. And they had this rotating list where, every few days they would have, a different doctor on the list and we'd be just essentially forced to sign the charts of these people. And so they were continuing to bill, even though I was no longer there, even though I wasn't even practicing in that hospital or that state anymore. And it turns out that, it alerted the Center for Medicare and Medicaid that I was supposedly practicing without a license because that license had lapsed in that state. I was no longer there. And so, it caused a huge problem for me. And it really got me thinking about my identity as a professional, my rights as a physician. And it made me realize, patients have all these rights. They have HIPAA, they have all these rules and regulations around their data and their information. But we as physicians, we have no protection from an employment and a credentialing standpoint.
Credentials verified.
That's an incredible story. And as a public service announcement, fire starters, every once in a while, you have to go on the internet and check yourself out. I just renewed my Pennsylvania license. And as I was going through some of the paperwork, realized my name was still attached to probably over a dozen nurse practitioners that I hadn't worked with in years. So hospitals and places and entities will have your information, and they may have some very old information, and it can certainly lead to some trouble, as it did in Dr. Houston's case. So that is a very scary thing, especially when you are being confronted from CMS or any large bureaucratic entity saying, hey, you're doing something wrong when you've actually done nothing wrong at all.
It's terrifying. Where do you go to check? Because I know that you can check your NPI, but you have to go by state, huh?
You do. And so it's very difficult. And that's part of the problem. You end up having to check all these different databases, whether it's the practitioner database, maybe it's your state licensure, because they carry a lot of information that may not be updated, especially if you leave a job or you leave an institution. When you leave, they don't necessarily go through your file and detach everything. The next place will just add on to it. So it could look like you were practicing in multiple states at the same time and lead to overall confusion. So get out there, Google yourself, check your NPI number, check with your state licensing authorities, even those that you may have inactive right now.
I did that once back then, but I guess I should do it again.
I was surprised. It recently happened. I said, here it goes again. I said, I don't know how this old data keeps hanging around. It never goes away. Wow. So that's certainly would qualify as a time in your career where you've been dissed, because I've always asked people if they've been dissed at some point in their career, and certainly having your identity stolen is there. Is there anything else that led you to going the DPC route and direct primary care?
Well, I think that, the whole principle of really wanting to be able to take care of everybody, regardless of their ability to pay, regardless of their, socioeconomic status, that's something that really pushed me into emergency medicine. And so I feel like the DPC model actually has the potential to provide that. New York State their laws are very strict for DPC, but in most states, especially states where they can dispense wholesale medications and get special rates on radiology and lab studies, the savings that people experience by not having to pay all these co-pays for their medications, it actually sometimes pays for the DPC agreement cost in itself. So it's essentially like they're receiving nearly free or very inexpensive care with a lot of DPC physicians. So I really love the model. I think that there's a lot of misunderstanding about it. People think it's the same as concierge, but it's really not. It's about doctors just wanting to be able to care for patients free from third-party interference and do the right thing again. So I love it.
No, that's a great way to continue to utilize your skills and gifts and training in a way that ends up being less of a hassle. So you end up with less bureaucracy when you're performing your care directly to your patients that way. So I applaud you on your efforts there and wish you continued success.
Thank you. Thank you.
Well, your newest company, HPEC, specializes in blockchain technology that intends to form what you call a doctor's decentralized autonomous organization, or a DAO. Please explain blockchain technology to us and how can it help us as physicians?
Well, a lot of people hear about the potential value of blockchain creating digital money and allowing for values of exchange between individuals in a peer-to-peer way. That's one amazing use case. But just like the internet had the original use case of email, blockchain has many, many other amazing use cases outside of just email communication. And we're realizing that now. The World Wide Web was essentially deployed into the US in 1991 or into globally. People didn't really adopt it until about 10 years later. So we're kind of at the 1993, 1994 era of blockchain, where people still know that, email is a use case. We know that cryptocurrency is a use case. We know that it has the potential for all these amazing things. AT&T set out all these ads in the 90s. Have you ever driven, through a highway and paid a toll without stopping your car? And all these amazing things that now are reality. And we hear a lot of that stuff around blockchain, but 10 to 15 years, they will be a reality for us because of this technology. And the thing that's interesting about this technology that applies specifically to physicians and all of our problems is that it allows for decentralization, which, we think about all the consolidation of health systems. CVS and Aetna are in the process of potentially merging. Health systems are buying up doctor practices. Private equity firms are buying up doctor practices. So that consolidation is also creating a system of control over the physician community. If you are employed, whether you really believe it or not, you are being controlled to a certain extent. They're giving you policy guidelines and practice guidelines, and you can choose not to follow them. But if you choose not to follow them too much or too often, you will be terminated, your contract won't be renewed, you won't get your bonus, you will be retaliated against, there'll be some kind of sham peer review or other nonsense. So essentially, this is a problem for physicians. The other thing that blockchain provides for is censorship resistance. Those kind of go hand in hand. So if we have digital wallets that can have our cryptocurrency, if we have in our digital wallets also our professional credentials, that process that takes 2, 3, 4 months to credential and move from hospital to hospital could take moments, seconds. And because of its secure nature, it allows you in a self-sovereign way, meaning only you control it, to own your credentials in a digital space and to have control over whether or not they're using your Medicare, Medicaid number, know exactly when they're using it, how they're using it, because it's attached to your digital wallet that you own and control. It also would allow for censorship-free peer-to-peer communication among physicians. No longer would be worried about retaliation. Most of us understand that if our patients think that we're trying to do the right thing for them, they give us rights to share their health information amongst each other. Who the patients don't trust are the health systems and insurance companies, and rightfully so, because many of these entities are using patients' data to find ways to deny services, deny care, then turn around and create policies that control the flow of money. If we had self-sovereign identities where we could communicate amongst each other about patient care, no longer would we need these third-party health systems to own and control our patients' personal data or own and control our personal data. The relationship will now be between us and the patient, and we'll only need to interact with these systems when we need to utilize them or if the patients choose to utilize them. If we have to use the operating room, okay, now we need to contract to use the operating room. If we have to admit our patients, okay, now we have an agreement with the health system to admit our patients. But that is an agreement that only comes after we as individual self-sovereign physicians decide which hospital to send our patients to. And we can decide the safest one instead of the one that unfortunately just employs us. The healthcare system is a $3.9 trillion system. And we as physicians, let's just ask the audience, like, who controls 80% of that? A lot of people say, oh, the hospitals, oh, the insurance companies. No, it's us. It's us. It's the physicians and surgeons. Without the stroke of a doctor's pen, nothing happens. You don't get a CT scan. You don't get surgery. You don't get admitted to the hospital. You don't get a prescription for a medication. So because we control that, then the systems over the past 20 years have found ways to control us by purchasing our private practices, by employing us, by controlling our referral patterns when we are employed. A lot of my independent physician friends who have been independent for many, many years are having a hard time because now all of a sudden the people who used to refer them lots of patients are no longer allowed to because they have to refer in-house. And they're very frustrated because oftentimes they're not really that impressed with the physicians they're being forced to refer them to, or the systems that they're being forced to refer them to. The physicians have no choice. Their patients they're lacking access to appropriate care because of this problem. And so this has the potential to fix that.
This is amazing because it actually opens up a world of possibilities that didn't exist before. And we are so trained to say, okay, well, our loyalty is to the system that employs us, or the entity in which we get our interactions, maybe the insurance industry. Sometimes we don't feel that we have our own control over our own information, our data, and all of these things that, well, as you mentioned, as a physician, if there were no physicians in the healthcare system, there really would not be anything getting done. Orders, tests, surgeries, visits, admissions, all of these things are tied directly to the physician. So there is a lot of power there. And it sounds as if blockchain can really provide us as physicians a number of protections because of this. And it's not held by a third party. Could you tell us a little more about that?
There's a lot of Facebook groups out there with physicians who are communicating about a lot of these problems because that's a way for them to do this without fear of retaliation. So they think, but Facebook still owns your profile. You put in your phone number and your email and your name, even if you change your name. And as these Facebook groups grow, they could potentially become censored. Also, the administrators of these groups could shut you down or shut the group down or delete or mute your posts, as could Facebook. I have a friend that has over 1 million followers, and a lot of his followers don't see his posts because Facebook has algorithms that decide. So essentially, your identity in Facebook is centralized and owned by Facebook. It's not owned by you. Same thing with Twitter, LinkedIn, Doximity, all of these, communications platforms, because that's the only technology that existed before. But now with blockchain technology, we have the ability to have self-sovereign identities, meaning the cryptography encodes for you to own your identity untethered from any centralized entity or source. And that's why it allows for censorship-free communication. Because if you own it and you control it, who can censor you? I want to consult with a physician colleague of mine. I could create what I like to call micro communities instead of groups. Micro communities around shared goals and common interests. So, you could have the pediatricians of Pennsylvania in a micro community attached to your digital identity, where you guys can communicate and discuss, things that concern you about, recent publications in pediatric literature that came out. Like, are you guys going to follow the guidelines or not? What are your concerns about, what's been published? Especially because private funding is what funded the majority of research in 2017 for the first year. We do have to start realizing that a lot of what's being published is potentially influenced by special interests. Sometimes physicians are being censored. They're not allowed to publish some data. My founding partner published data in some studies in the 90s about opiates. He was the head of the pain management department at Washington University, and his hospital told him not to, or I don't remember if it was his hospital, but he essentially was being discouraged from publishing the truth around opiates. He, with integrity, chose to publish anyway, and then he was dissed. He was blacklisted. He was fired. He was sanctioned. And Purdue, one of the leading producers and manufacturers of opiates, sued him for publishing this data. Now, of course, he won, but he was tied up in years of litigation, and his career was completely, so he was the head of the pain management department. He didn't think that he was at risk of any of this stuff, but there's a lot of powerful forces that are really, people don't realize how powerful they are until they try to start resisting and pointing out some of the frailties in the system. So I think that physicians, we took a Hippocratic oath to do no harm. Most of us went into this to help people, because if we wanted to go into to make money, we would have done something else. And so we should be the ones that are collectively and ethically making decision guidelines around patient care. So there's so many different things that can come out of this digital identity solution. Not only are you going to own your professional brand, protect your credentials, protect the exploitation of your billing coding practices by health systems, but we could produce a consumer reports of all things healthcare designed by the Doctors DAO, the decentralized autonomous organization of physicians, where that what is being published is censorship free because it's the individual doctors publishing it. That it's not influenced by special interests because, there's no board of directors that are being slipped a check or sent on a vacation to refuse to publish things. It's really a direct democracy of doctors. And that way patients will get better care. We'll have the real guidelines on how best to treat people, not just, the Joint Commission coming in and pushing a policy on us based on some lobbying efforts of some big pharmaceutical industry, which is how the opiate crisis actually occurred. People don't realize that. So, there's lots of potential for this. We can have the decentralized advertising area where you can put yourself up as available to work, as available as an independent doctor. So we won't need, these advertising agencies like ZocDoc, who they charge you $3,000 as a doctor to have your profile on there. And then anybody can sign up for an appointment and not show up, and there's no retribution. There's just so many things that we have as a potential for this. However, if we choose not to adopt it, then it will never be. So we need to consider the possibility that this could help us and help our patients. because in order to help our patients, you need to help the doctors get back to taking care of people again.
And by doing so and adopting this technology, you get some of your own control and power back. You actually will own and be in charge of your own data, whether it's in outcomes, whether it's in your credentialing files, and it doesn't have to depend on all these other third parties that can get in the way here. I mean, I just thinking about credentialing to a new hospital and answering all those yes or no questions that we always have to do, and knowing that if there were a faster way to do it, the information is already there and it could just be disseminated, or you could direct it to be disseminated to different organizations or different places, which can take that information and have the process done nearly instantaneously rather than the months that it takes. This is exciting to even think about this. And by being in control of that data, it leads you to be, almost recession resistant.
Yeah, no, absolutely. I mean, patients demand service from physicians. In a healthcare system where, there's third parties that control the system, we're essentially forced to behave in a certain way. If, in a future blockchain economy, if you provide value, then you can transact. If the dollar collapsed, there would still be people that needed healthcare, and there would be still doctors willing to provide the care. But if you're in an insurance or in an employment model where the only way you can get paid is through insurance, and where the only way a patient can get healthcare is through insurance, then the recession will basically make you as a physician jobless and make your patient, without healthcare. A digital identity solution for both patients and doctors where they can interact will kind of untether themselves from the need for a third party, including the insurance companies, if they choose to. If patients still choose to use insurance, they're welcome to. If doctors still choose to take insurance, they'd be welcome to. And if the insurance industry is providing a value to both parties, then maybe we will continue to use insurance. But if not, we won't. It's the self-sovereignty that really allows for that. It's got a lot of potential. I think that it's just a very big jump. It's hard for people to get their head wrapped around the fact that they don't need a third party to suture somebody's wound or to give somebody a flu shot. You really don't even need a third party to perform an operation if you have access to an operating room and staff and equipment. Yes. It's a big jump, but I think people are slowly starting to get it.
The comeback.
There's a quiet revolution happening in the physician community where we are independent thinkers, and we've been taken advantage of. Our kindness, our generosity, our desire to help, desire to work with people. We're very conservative. We're conservative in our financial decisions and our decisions to become doctors. That's a pretty conservative decision, very careful, very calculated people. So it's hard for us to consider new possibilities around this and to consider that the status quo is not serving us. But I think enough physicians have been disarmed, disempowered, discredited, all of these things that you mentioned, that they're starting to finally realize that they need to step it up and take control and ownership of their professional brand and take ownership and control over their practice of medicine again. We're the only ones that know how to do it.
Yes, and many times it feels like we've lost control completely, and that's what sends people looking in so many different directions to find something different, because once they got in the healthcare system and see how it operates and runs and how, although we as physicians could have a lot of power, we have very little power when we keep engaging with these third parties, multiple third parties. So this is great. And this has been a fascinating discussion and a very hopeful discussion, because I just can see the future coming, and I can see this world of possibilities that you are working on right now. And it really has tremendous potential and will be amazing. Where can people find out more about you?
They can go to the website, www.hpec.com. .io. That stands for Humanitarian Physicians Empowerment Community. And just sign up for the newsletter, learn more. If you have any questions directly, you can email at support, SUPPORT, at HPEC.io. And I'll get back to you as soon as I can. And, if you're interested in investing, especially, I want to keep this doctor-owned, physician-owned. And, I'm actually meeting with my attorney today around the PPM and getting those documents out. And there's a lot of companies that are trying to do somewhat similar things, but in a centralized way where they're trying to work with health systems. We don't realize how valuable our physician data is. There's lots of companies out there that are paying for our prescribing practices, our referral patterns, for every time we log into an e-prescribe, or the health systems that are employing us and the insurance companies that are paying us are selling that data and making lots of money off of it. So if we own that data, then we can make lots of money off of it instead. And that's not what this is about. But I want people to realize that this isn't just a get your identity and, communicate, but this has the potential to redistribute power away from the entities that have been exploiting us and are no longer serving us or our patients. We protect our patients' rights. We always have wanted to protect our rights. I know as a doc, I was yelled at by administration once for printing out a CT scan for a patient because they were on vacation and I wanted them to have a copy. And I knew that if they went through the hospital, it would take forever and they had cancer, likely cancer found on this new scan.
Oh, no, not another test.
So I was trying to do the right thing, be a good doctor, take good care of my patients, do the ethical thing. And actually what the law says, especially with the 21st Century Cures Act, the law says that patients should get access to their records and that we are required to provide that to them. But there's all these roadblocks put up by health systems and insurance companies because they make money off of the patient needing a second CT scan because they can't get a copy of the first one. And that causes direct harm. So, we have no problem sharing our patients' data with them. We have no problem giving them access to their records. At least in my opinion, I don't. So, I think that we need to stand up for the rights of our patients by standing up for the rights of ourselves. And that this technology allows for a mechanism to do that.
Very well stated. I mean, I can't sum any of that up better than that, Dr. Houston. Thank you for coming on the show today. You have provided us with a wealth of knowledge and some up and coming technology that really will revolutionize healthcare, particularly in the life of the physician and the patient. Is there anything else that you'd like to say to our audience today?
I just want to say thank you to you, Dr. Jarrett, for creating the show, for giving people an opportunity to hear the truth, and an opportunity to learn all the things that their employers and their health systems and the insurance companies and sometimes the government and the news doesn't want us to know. That's the power of podcasts like this. So please, I encourage you to share this with your fellow colleagues, send it to them in a text or an email, continue to listen to things like this, to stay aware, and to consider the possibilities.
Final judgment. Licensed to live.
Well, thank you for that, Dr. Houston. That was incredible. And I really take that personally. So thank you very much. And I'm so glad that you could be on this show. Thank you for spending some time with us. And certainly as new things develop with you, make sure you keep us posted so we can bring you back with an update.
Absolutely. Thank you so much. Thanks for listening, everyone.
Remember, fire starters, if you or anyone you know has been disengaged, dissatisfied, disheartened, disgruntled, disenfranchised, disempowered with healthcare, please invite them to join us along this journey. Simply go to your favorite podcast distributor and subscribe to Licensed to Live. And while you are there, please rate this episode and give me honest feedback so I make sure I provide you with the most up-to-date information about career challenges and life changes. And don't forget to pre-qualify for the License to Live one-on-one coaching program by making an appointment now at timewithdrjarrett.com. That's time with, spell out the word doctor, J-A, 2 R's, E, 1 T. See you next time.
No matter how disheartening the moment of accusation sounds, how deep the pain of immobilization stabs, or how bleak your future looks, no one can take away your license to live. Keep Dr. Jarrett's expertise handy and unlock your future. Go to Apple Podcasts, Google Podcasts, or another podcast player and subscribe right now to Licensed to Live. See you next time.